Signs of aging in the face and neck occur for many reasons, such as heredity, skin type, sun exposure, and lifestyle choices. If you are bothered by a combination of deep facial wrinkles, sagging jowls, drooping eyelids, or loose skin and excess fatty deposits under your chin or on your neck, a facelift may be right for you. A full facelift is best described as a combination of separate procedures that affect different areas of the face. Not all people need the same procedures, so what may be full facial rejuvenation for one person may involve a slightly different set of procedures for another. Typically, a full facelift involves a lower or mid-face lift, a forehead lift, and sometimes eyelid surgery. Your plastic surgeon can help decide the best options to give you the results you desire. A general overview is presented here, and surgical details for individual procedures commonly performed during a full facelift can be viewed separately. A forehead lift, also known as a brow lift, reduces forehead lines and creases and can improve frown lines that may appear between your eyebrows. Sagging eyebrows may also be lifted with this procedure, restoring a firmer, more youthful appearance to the upper portion of your face. Eyelid surgery, also known as blepharoplasty, may be performed on the upper eyelids, the lower eyelids, or both. During eyelid surgery, fatty deposits are removed or repositioned, and excess skin and muscle tissues are often removed to brighten the appearance of the eyes. The mid-face lift, sometimes referred to as a cheek lift, rejuvenates the center of the face in an area approximately from the corners of the eyes to the sides of the mouth. Underlying muscles and fat that have sagged over time are lifted back up onto the cheekbones. A lower facelift can help to reduce the appearance of deep facial wrinkles, sagging jowls, and sagging in the neck, restoring a firmer, more youthful appearance. During a lower facelift, underlying tissues and muscles are repositioned. Fat deposits are removed, facial skin is tightened, and excess skin is removed. Consult with your physician to discuss the best options for you. You may learn more details about specific procedures in individual animations or by researching the particular procedures.